Today, our topic of discussion is obsessive compulsive disorder. It is an anxiety disorder. Obsessions are recurrent anxiety provoking thoughts, ideas, or feelings coming into mind again and again, which patient knows that these are inappropriate and want to get rid of them but cannot and cause anxiety and distress. Compulsions are obsessions followed by physical activity or actions. For example, many people develop obsession with cleanliness and contamination. They think their hands are not clean once they wash their hand and keep on thinking that their hands are clean or not. It is called obsession. And if they go again and again and wash their hands, it is called compulsion. The incidence of OCD in general population is 2 to 3% and there is a high comorbidity with major depression in 2/3 of OCD patients. Male to female ratios are similar with highest rates occurring in young people who are divorced, separated or unemployed. Causes of obsessive compulsive disorder. Cause is unknown. Genetic factors and environmental factors believed to play a role. Can be drug-induced antipsychotics like olanzapine. Identical twins more often affected than non-identical twins. Serotonin neurotransmission abnormalities in the brain, though exact mechanism is not known. Diagnosis. To be diagnosed with OCD, person must have obsessions, compulsion, or both, according to DSM. Person's daily life is negatively affected. Most adults realize that the behavior do not make any sense. Identical twins more often affected. Management include pharmacotherapy and behavior therapy. First of all, pharmacotherapy include selective serotonin reuptake inhibitors SSRIs, fluoxetine, fluoxamine, sertraline, paroxetine, citalopram, and escitalopram. Clomipramine, which is tricyclic antidepressant. Behavior therapy include exposure and response prevention, some forms of cognitive behavioral therapy, then comes education and family intervention. These also play important role. Neurosurgery in extremely refractory cases play an important role.